is Brittany Wilson, and I am going to be discussing the importance of your oral health. So from the beginning of time of life until the end of life, there are a few things that truly matter. Your overall health is one of those things. Did you ever think to consider that your oral health contributes a lot to your overall health? It's important to see your dentist every 4 to 6 months. Your dentist will help you to maintain your oral health. They will also help you fight serious side effects of poor oral health. And I will also be discussing the discomforts of unhealthy oral conditions and treatment options. Seeing your general dentist is important to your overall health. It is necessary to see your general dentist every 4 to 6 months. The reason why is because your general dentist can help check for cavities, remove plaque and tartar off of the surface of your teeth, take x-rays to verify that there are no cavities in between the tissue or the gum or on the teeth. The dentist will also check your gum tissue and should be checking for oral cancer and doing an oral cancer screening. If you can see your dentist regularly, then they can diagnose treatment early. So this will help to prevent any more severe or any issues to increase. So gum disease and its links to other conditions. I found this resource in Medical News Today. Gum disease, which is also called periodontal disease, is widespread. According to Centers for Disease Control and Prevention, almost half of adults in the U.S. have some degree of gum disease. So treatment plans, if there are areas of concerns, it's important to follow the treatment plan that your general dentist gives you. If you have concerns about finances or the order in which the treatment is recommended, definitely discuss that with your general dentist. They're trained to understand not everybody has, all of the money up front to just get treatment done. So they definitely understand that sometimes it's best to do it in phases, and typically they want you to at least start somewhere. Start with, even if it's like the deeper cleaning, to make it so that infection doesn't consist or can continue. So if you have concerns about finances, definitely mention that to your general dentist. If the treatment plan isn't followed, conditions can worsen and more extensive work will be needed. So now that I've told you about the importance of seeing your general dentist regularly, I'm going to discuss the serious effects of poor oral health. Oral infections contribute to different conditions. Heart disease is one of them, diabetes. We also have obesity, and there are other conditions as well. General dentists, it's important to see every 4 to 6 months, or you can build up the bacteria in between your gum tissue and your teeth and the roots of the teeth. Plaque and tartar builds up, which creates pockets in between the gum tissue and the root of the tooth. It also creates further infection and can create bone loss as well. So an article from WebMD, the mouth and body connection. In one recent study, people with serious gum disease were 40% more likely to have a chronic condition on top of it. And in this presentation I've got here, so this does show, this is what your healthy gums look like. You've got 1 millimeter to 3 millimeters of healthy tissue, or of where the probe goes down. So 1 to 3 millimeters is still considered healthy. And then 3 to 5 millimeters is mild periodontitis. So you can see that the probe goes down just a little bit deeper. And moderate periodontitis is 5 millimeters to 7 millimeters. So the probe is going down even further into that gum tissue down the root of the tooth. And then severe periodontal disease is 7 millimeters and above. So this is, you've got severe bone loss. There's a lot of bacteria and plaque that's being built up down into the gum, the root of the tooth. So it's really important to make sure that you see your general dentist in order for them to do the right treatment to make sure that you can get that bacteria cleaned out and maintain good oral health. So one thing that I mentioned, it does spread deeper into the gum tissues. It also can spread, bacteria can spread down into your bloodstream. So the dentist will potentially need to numb you and clean out the infected tissue and plaque so that your gums can potentially reattach back to the roots of your teeth. Tooth loss or infection spreading can again go to your brain, your heart, and your lungs. So now that I've told you about the serious effects of gum disease, I'm going to now tell you about treatment options. So just as you have any other health conditions or concerns, dental health is equally as important. If you go to a heart doctor and they tell you you've got some blocks in your cardiovascular, I'm not very familiar with it, but your cardiovascular health, you're going to figure out what you can do for treatment. You're going to get on blood thinners. You may need to go and get surgery and have a stent put in. The same things will happen with your oral health. If you do not get this taken care of, it will continue to worsen and worsen. So if you don't get the treatment, the condition will worsen. Treatment options may be something similar to, like I had mentioned, deep cleaning, bone grafting. You may need to get some teeth extracted, or even potentially dental implants. Dental implants are a great option if you are at that point. They can last a lifetime. So treatment options that were recommended from Dr. Aaron Ward, who is a periodontist and specializes in dental implants and gum disease. He says there are a few different treatment options depending on the severity of your condition. The least invasive would be regular periodontal maintenance every 4 to 6 months. If your gum disease is more involved, we may recommend tissue grafting or deep cleaning. If the gum disease is severe and there is a substantial amount of bone loss, we do have implant-supported prosthesis. Implant-supported prosthesis is if the gum disease has made your entire mouth pretty much a 7 millimeter or above pockets, and you just have really bad infection, cavities, things like that. They may recommend removing all of your teeth and placing dental implants with basically what's a dental, like dentures, but they're implant supported so they don't come out, which is a great option if you're at that point. So now that I've shared the importance of seeing your general dentist regularly, you have the awareness to maintain your best oral health. Seeing your general dentist every 4 to 6 months to maintain your gum, bone, and tooth health, and also watch for oral cancer. Do not avoid the general dentist. If you are nervous, if you are concerned about finances, discuss those options or discuss those concerns with your dentist. And this will just help you be on the same page, and also it may help you feel a little bit more at ease. So I do have a couple testimonies from patients that were seen by Dr. Ward. So Will Harris says, eating and chewing and pain plus the discomfort was what I am always dealing with. It's a big issue that most people don't realize. It affects my mood, my smile, and a lot of things. My teeth have been my last priority. Will did end up getting treatment with Dr. Ward. He got the full mouth restoration and got dental implants, and it completely changed his life. And so that's kind of like the end route if you are not able to catch your severe cases earlier on. Another thing that oral health can contribute to other heart concerns or other health concerns, sorry. Oh my goodness. Know that oral health can contribute to other health concerns. So there are many treatment options, and it never hurts to get a second opinion. Discuss it with your general dentist. Let them know your concerns, like I said, finances or the treatment. But also, it is very beneficial to get a second opinion from another doctor. If your overall health is important to you, please be sure to visit your general dentist every 4 to 6 months. And then finally, I do have a resource from Cigna.com. And this is just to close off. Dentists can detect cavities early. They can catch gum disease early, detect early stages of oral cancer, check your fillings, catch any dry mouth or bad breath, review your oral hygiene, protect your overall health, and safeguard your family's oral health. So please, please, please make sure that you regularly visit your general dentist to make sure that you can maintain your oral health. If you're at a point where maybe your oral health has declined, still go in, see your dentist, get treatment options, and go from there. Thank you so much.